When you develop type 1 diabetes, the cells of the pancreas that make insulin don't work as well and eventually stop working. At diagnosis, the blood glucose is usually high as the body is not able to make as much insulin as needed. When some food containing carbohydrates is eaten, it moves from the mouth down into the stomach. In the stomach, the carbohydrates start to get broken down. This is known as digestion. Unfortunately, the pancreas is not able to match the amount of insulin needed for the amount of carbohydrates eaten. There may be a small amount of insulin produced at first, but this eventually stops. The food is digested in the same way and glucose is produced. This glucose moves down into the digestive tract, where it is absorbed into the bloodstream. As you can see, although the pancreas may make a small amount of insulin, it is not able to produce enough insulin to match the glucose produced. Without insulin, the glucose cannot get into the cells of the body to be used for energy and the blood glucose level rises. This is when the signs or symptoms of type 1 diabetes develop. As the cells cannot use glucose for energy, this makes you feel tired. As the cells are not able to get the glucose they need, the body starts to break down fat cells for energy and produce something called ketones. This can lead to weight loss, and ketones make you feel unwell. You become thirsty as the body tries to flush out the glucose. This thirst can feel unquenchable. The only way that the body can get rid of the glucose and ketones is to weed them out. The classic symptoms of type 1 diabetes are known as the 4 T's: toilet, thirsty, tired, and thinner. If the amount of glucose and ketones in the blood build up too high, this can lead to a condition called diabetic ketoacidosis, or DKA. This will make you feel very unwell. The only treatment for type 1 diabetes is replacing the insulin by injections or an insulin pump. The aim of insulin therapy is to mimic what the body does in someone who doesn't have diabetes.